was clear at the beginning of this video that with Red Berets Medicare for All, I chose Red initially from the inspiration of National Nurses United because they are a labor union that strongly advocates for national improved Medicare for all, and they know that if other developed nations on Earth have either some form of universal health care or a single payer system, we, the wealthiest nation on Earth, absolutely can do the same. It will save money, it will cover everybody. We won't have all of these. I think it's one of the biggest cause of homelessness is medical bankruptcy, or the second biggest reason. And it's just a travesty that we have tens and thousands of people dying because they can't afford to see a doctor. So I wanted to bring creativity to the Medicare for All movement, and we are strongly supportive of all good universal health care or single payer. That's not the same as a public option. We're talking about Medicare for all or a single payer system, and so we do a lot of advocacy work locally for whole Washington, and then of course supporting such bills as Senator Sanders' bill SB 1804 and what will be Representative Pramila Jayapal's new bill. I'm not sure the bill number or if we know it yet, but it was previously HR 676 for the House. And there's a lot of debate among single payer advocates and everybody that is in this conversation about what is the best bill or what is the best way to get there, state level or at the federal level. With Red Berets, I want us to focus on increasing grassroots involvement and bringing everybody in to the activism fold so that we are supporting all good efforts and not getting into the debate of we will support this bill and not the other. I do want to emphasize that when people are for a public option or for shoring up the ACA or for Medicare Advantage Plus, any of these centrist, corporate-friendly alternatives that will have Medicare in the title, but they're not Medicare for all. That is not what Red Berets are doing. We do not support those efforts. We do not believe that we need a pathway to get there. We need a truly single-payer system, and that is what we are putting our advocacy behind. And so we do, in addition to crafting these Red Berets, we ask people to get involved with their local Our Revolution groups, canvassing for Justice Democrats who are running on an unapologetic Medicare for All platform. Local nurses or DSA groups that are working on going out and canvassing. Anything that's happening in your local community where you can kind of plug this creativity in to the advocacy work, any groups that are fighting strongly or working on Bernie Sanders' campaign. He's the one who has introduced this legislation. He's the one that we know has advocated for decades. We don't need to wonder if he's the Medicare for All candidate because he's the one that's been fighting for it for decades. So anyone that co-sponsored his legislation because they knew that they were going to run in 2020, for me personally, and I know I can speak for a lot of Red Berets so far, platitudes and promises and just simple co-sponsorship are not enough. We appreciate their co-sponsorship, but in order to actually see us move to National Improved Medicare for All, we will need to elect a lot of new Congress people to the Senate and to the House because we have a lot of representatives that are taking corporate PAC money from insurance companies and pharma, and they can say that they're for, eventually moving in that direction, but that's a conflict of interest. You cannot be both for your corporate donors and for a system that would truly benefit the 99%. The two are the opposite, and you're one or the other. So, sweetheart, hang in there another minute, okay, please? So that's that. I want to provide that clarity on this video because people have asked me, is this the Bernie group? Do you have to be, for Bernie in order to wear a red beret? And the simple answer to that is no. I mean, this is a grassroots movement. I can't make you, maybe you are strongly supportive of Tulsi Gabbard. I think that Medicare for All is on her platform. She would be the other candidate. I have my issues with Elizabeth Warren, even just if we focus only on Medicare for All. I am not going to get into the other reasons why I personally have very strong reservations about calling her a candidate that I would support. But I have really carefully watched who has been using their social media platform to help educate voters and to get the word out about why the numbers make sense and how we will pay for Medicare for All and how many lives it will save and all of that stuff. That has all been strongly advocated for by Senator Sanders, and I saw almost complete silence on the other Twitter feeds up until when it was convenient, about a month ago, 2 months ago, when everybody started to announce. That's when we started to see a little bit show up. That's not good enough for me. I'm the founding member, so I really speak for Red Berets as a grassroots organization. We need to put our support behind someone who is willing to go out and endorse uncorrupted candidates who are not taking any corporate PAC money. And the only person who did that in the midterms, again, I didn't follow Tulsi closely enough to know if she was endorsing and campaigning for uncorrupted Democrats. It might be the case, and let me know about that, but I certainly absolutely know that Senator Sanders was doing that, and our revolution with President former Ohio State Senator Nina Turner, who was the president of our revolution. Absolutely, our revolution endorsed uncorrupted Democrats who were running on Medicare for All. And this is the reason why when people ask me, are Red Berets the Bernie group? Everything that we can point to, evidence-wise, and activism-wise, and leadership-wise, points to Senator Sanders as being the leader of this movement who will actually fight hard enough to help us move in that direction. So my answer is yes, essentially. Now what is great about these is if people want to be quite apolitical, like they really believe in organizing for issues and not on a, partisan or for particular candidates, that's completely fine. Get a red beret and put a Represent Us button, or a Medicare for All, or a Physician for a National Health Plan, PNHP, Nurses United, whatever organization, or just Medicare for All, just a button that says Medicare for All. So I'm saying this is your beret if you believe in National Improved Medicare for All and you believe that we need to organize outside of partisan politics. We have found a vehicle for you to be included on that. You do not have to wear buttons of any particular candidates or party affiliation. I'm knitting these for strong progressive Democrats, and I'm knitting them for Green Party members, and I'm knitting them for anyone who is building efforts for a progressive or movement for a People's Party, nurses. I hope I'm conveying that this is about the issue. It's also that if there are candidates, like I've been knitting for Sima Hernandez because she's running for Senate in Texas against Senator Cornyn, and she is a fierce Medicare for All advocate, uncorrupted, taking no corporate PAC money. So if it were me and I was going to a rally and I lived in Texas, I would have my SEMA for Texas button on my red beret. That's me. But you can see that there's a lot of flexibility in your choice, what you choose to put, which buttons you choose to pin on your beret. I would have a conversation, again, this is very grassroots, and so people will pin what buttons that they do on. I will educate people as to if someone asks me, or they're like, well, doesn't Kamala Harris support Medicare for All? She's a co-sponsor. If this person's out advocating for Medicare for All, I'm not going to be, rude or uncivil about it. If they ask me the question about it, I would be the person to say, well, we have to follow the money and we have to follow the track record of that person, and not just when it became politically expedient to co-sponsor. And also saying that, we kind of need Medicare for All, but we might be fine to do, a pathway or a public option first. That, for me, that's absolutely a non-starter, and I think that I speak for many, almost every person that's in the Red Berets movement so far. Possibly not everybody, but, we're very much about looking at following the money and following where has this person, have they led with their values, and what have they, as a grassroots activist who I've knit hundreds of these by now, and gone out gathering signatures for whole Washington when they had Initiative 1600. My litmus test is not just for somebody to stand and say that they are for Medicare for All. It's actually, wow, here's how many hours that I have donated to this cause, and I expect the person who's asking for my vote to have done at least as much as a grassroots activist has. And I feel like that should be, everybody should have, a similar standard, because how would we really expect, to, as people are very fond of pointing out, we're up against incredible corporate influence, a lot of, money and power with Big Pharma and the insurance companies that will throw a lot at defeating this. So, my question to people would be, if somebody hasn't been brave enough and clear enough to call out that we need to take the profit motive out of insurance, out of our healthcare system, and been, consistently on that message throughout most or a significant portion of their career, why would we think that, that's going to be their agenda? Anyway. So I'm just knitting. I kind of